Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there are 2 new cases of COVID-19 to report. The total number of cases is now 289. As of this morning, 4 individuals are hospitalized and there's 1 person in intensive care. 247 individuals are listed as recovered and we have 35 active cases. Yesterday, 374 lab tests were performed, bringing our total to 31,029. Over the weekend, 2 additional cases were identified as part of the small cluster of cases in the Prairie Mountain Health region. That brings a total number of cases associated with that cluster to 10. These latest cases were identified as close contacts of existing cases and were not employees of that workforce. Affected staff and their close contacts are self-isolating, and again, we do not feel there is any exposure to the public. As the weather is starting to look up for us, we want to remind everyone that we've not returned to normal, that this virus is still circulating in our province, and if we loosen up too quickly, we could see a reversal of some of those numbers. We could see this virus being transmitted again at higher rates. So we wanted to continue to enforce that all Manitobans keep this virus in mind. Do not gather in large groups, washing your hands frequently, and physical distancing whenever possible. We've known there's some reports of people that were unable to maintain physical distancing and were out and about, and just really want to remind Manitobans that we're not done with this virus, that we could see a resurgence if we're not careful. So please keep in mind all the things we've been working so hard to keep under tap so far. We're continuing to encourage Manitobans who have symptoms of respiratory illness, fever, cough, runny nose, sore throat, consider to be tested for COVID-19. We have much more lab capacity than we're utilizing at this point, so we want symptomatic Manitobans to be tested. It's important to quickly diagnose cases. We can do contact investigations, and it just will increase our ability to limit the impact of this virus. As we start to gradually reopen our economy, we're following a number of indicators very closely to ensure that we continue to be on top of this virus. And so certainly we have not returned to normal, and our actions over these next weeks to months will be crucial in keeping this virus at bay in Manitoba. So we all know the type of things that are important to do. Washing our hands frequently, disinfecting commonly used surfaces, physical distancing when at all possible. And what's vital to our way forward is people who are ill, people with respiratory symptoms cannot be out at work, cannot be going to school, cannot be out shopping. So it's just a real change in the way we do things. So please, if you're ill, stay home. Call HealthLinks for further advice. Keep in touch with your healthcare provider. Certainly, we've also heard reports of people delaying their healthcare needs. And so certainly there is no need for that. I want to encourage all Manitobans to know that our healthcare facilities are safe, that it's safe to see your physician. It's important to call ahead. Some of these things can be done virtually, but don't let your health get out of, fall behind on your health at this time. It is certainly safe to keep up to date with your healthcare needs. For those people who are in the high-risk category for developing severe outcomes to COVID-19, those over age 65, those with underlying medical conditions, things such as respiratory and cardiac conditions, hypertension, and those with immune compromise, need to be extra cautious. For the most part, you should be staying home, as was in the last phase. And again, washing your hands, physical distancing whenever possible, but you do need to take those extra cautions for those people that are in higher risk. Businesses that have questions about how to how the orders apply to them, can contact engagemb.ca for further advice. Manitobans can continue to access our website, manitoba.ca/COVID-19, for up-to-date, credible information on this virus. I want to share at this time that as we're moving to the next phase of this pandemic, we are stepping back from these daily briefings and we'll be moving to every other day, so Monday, Wednesday, Friday. Things will always be evolving. We'll still have daily briefings, but these particular conferences will be Monday, Wednesday, Friday for the foreseeable future. And I want to say thank you again to all Manitobans. And before I turn it over to Lanette, I wanted to acknowledge that this is National Nursing Week. The World Health Organization announced that 2020 was the year of the nurse and the midwife, and that certainly couldn't have come at a better time. And so to Lanette and all the nurses and the frontline staff, let me say thank you, and your leadership, your expertise, your empathy, your hard work has been so vital to our response here, and it's going to continue to be so vital. So I want to thank Lanette and all nurses around, and just wish them a happy National Nursing Week. So thank you very much, and I'll pass it over to Lanette now.
Thank you. So I'm Lanette Siragusa from Shared Health, the Chief Nursing Officer, and I too want to acknowledge that it is National Nurses Week, as well as Allied Healthcare Professionals Recognition Week. So I want to thank everyone, all healthcare workers really, at this time. We know that COVID-19 has dramatically changed the lives of Manitobans in a very short period of time. And this is especially true for our healthcare workers who've been asked to rise to the challenge of a lifetime and face this virus head on. Each and every member of our healthcare team plays an incredibly important role in our response to this virus. So whether you're a nurse, although I'm a nurse, so a special shout out to the nurses on Nurses Week, but also all clinical and non-clinical staff. We work as a team: cleaners, support workers, allied health professionals, the list goes on. In the face of this adversity, healthcare workers continue to show an enduring commitment to caring for those in need in the community, in the hospital, in long-term care facilities, and every service we provide, but they also take care of each other. So the efforts of all the people in our healthcare teams is very much appreciated, and it's an inspiration. So thank you for your professionalism and your compassion and your dedication. We will continue to do everything we can to support you in this fight, in this pandemic, because it really is just the beginning. Good start, but it's going to go on for many more months to go. So in the meantime, the best gift that Manitobans can give healthcare providers is to stay home when you can, certainly when you're sick. Practice social and physical distancing when you go out, and regularly wash your hands. So we are all in this together. We've repeated that phrase for many months now, and we continue to reiterate that and thank our healthcare professionals for all that they do. I want to give you an update on mobile testing. So last week we announced that plans were underway to launch the mobile testing for COVID-19. And this is specifically for individuals who are homebound and can't get to an access site or a testing site. Also for those who are immunocompromised and should not be out among sick people. So the first mobile testing resource launched today in Winnipeg and will be provided by the Winnipeg Regional Health Authority's Home Care Rapid Response Nursing Team. So this service will be appointment-based, and referrals can be made through HealthLinks as well as through the COVID response unit. So the hours of operation for the mobile testing will be 9 to 5, 7 days a week. As a reminder, the testing criteria has been expanded to anyone who is experiencing flu symptoms. So that could be flu, cold, fever, cough, runny nose, sore throat. If you're experiencing any of those, you are encouraged to get tested. As well as a final update, there was a question on Friday about the Thunderbird House. And so this is a community testing site that is expected to open within the next week. So this location will provide access to Winnipeg's homeless and sheltered population, as well as others. But we will continue to provide information on this as we get closer to its opening, which is imminent. So with that, we can open the line to questions.
Thank you. A reminder for reporters on the line, we will go through our list. You'll get one question, one follow-up, and we'll take more questions if there is time. Starting today with CJOB, Diana.
Good afternoon, Diana for 680 CJOB. Dr. Roussin, you mentioned a few weeks ago that the province is considering a contact tracing app. Where are we on that right now?
Yeah, we're still looking at that. Still looking at the features of such an app that we would want here in Manitoba, and ensuring we'll get an acceptable type of app for that. So we're still looking closely, but we haven't had any for sure acceptance of a given app yet.
Okay, and then just as a follow-up, what's the average turnaround time for results for both positive tests and negative tests right now? We've heard of someone who got tested kind of last week and they still haven't got their results almost another week later. What's the average time on that?
Yeah, so that's a difficult thing to record. We know the lab turnaround time is the total lab turnaround time is a little bit under 48 hours at this point. But when a specific person hears about the test, it's tough to know. The positives are usually within 24 hours of the lab reporting out the positive. The negatives now will be even more difficult to follow up because we have the online portal. And so people can access the online portal to look for their negative results. So it will vary.
From the Winnipeg Sun, Scott.
It's Scott Billick, Winnipeg Sun. Question, so here's for Lanette. The nurses union today coming out saying that staff are being forced to wear masks throughout their shifts. They don't get a second one after breaks or after lunch. Just wondering if your thought on that, and is that the case right now, or are staff being limited to one mask per day?
So the PPE guidelines continue to be adapted based on evidence that we have, as well as clinical guidance from our local leaders. So my understanding about the masks, it differs depending on the environment that you're in. So if you're working in a COVID-specific unit, it would be different than if you're in a lower risk area where there's no COVID patients. So it has been identified as red, orange, green, or red, yellow, green, depending on the risk, and also depending on the situation. So on a green unit, for example, we don't normally, staff wouldn't normally wear masks, but in the case that we're in right now, an unprecedented pandemic, we are encouraging staff to wear masks and wear them throughout the shift just for their safety. So that may be true on certain areas, and it would depend on which area and what kind of care is provided. Of course, if it's a situation where there are infection control issues like MRSA or C. diff, the appropriate precautions would also be applied to that on top of the PPE for COVID.
Okay, and is there, I think you talked about last week, but is there a shortage of these masks? Like, is there a reason why, I guess the same things wouldn't be extended to anybody working in healthcare right now just because of the risk?
Yeah, it's my understanding that we have a good stock of supply of the simple basic procedure masks, the surgical masks, but this is a long game. So when we are asking staff to wear masks in situations that they maybe wouldn't have worn masks in the past for their safety, we do want to be cautious. We want to use them appropriately, and we need them to last. But of course, the safety of the staff and the patients will always come first. So if there's a breach in any of the PPE and the infection and prevention protocols, then those should be considered as well. But from my understanding, we do have a fairly good stock, and of course, it's always dependent on the supply, the inventory getting delivered. But right now, it's just really being proactive in conserving our PPE for the long road.
From CBC Radio Canada, Mohammed.
Hello, my question is for Dr. Roussin, I think. Mohammed from CBC Radio Canada. It is a question. I was at the anti-lockdown protest on Saturday, and people are saying that COVID-19 is less deadly than a normal flu. What can you answer to people who think that?
Yeah, so I would say that the evidence is pretty clear that the COVID-19 is certainly more severe than a seasonal influenza. I think you don't need to look very far to other jurisdictions to see what they've been battling with to understand that. So certainly a seasonal flu epidemic, typically we would usually have the case fatality rate to be about 0.1%. The case fatality rate of COVID-19, it's can be early to know definitively, but we look to 2 to 3% of it, and in certain areas it's been higher than that, others it's been lower. But so I think it's really clear that this is more severe than a typical influenza year, and I think the evidence is pretty clear on that.
Thank you. And I have follow-up about the small cluster in the Prairie Mountain region. Do you know how many people are waiting for the results related to this cluster?
Yeah, I don't know how many people are waiting necessarily. I know I think the symptom onset of the first case was near the end of April, and we have these 10 cases now. Certainly the most recent cases were known contacts, so they were isolating at the time, so likely not very many contacts that they would have to investigate. So I don't necessarily know the exact number of people still waiting for results right now.
From CBC Manitoba, Aiden.
Hi, Aiden from CBC. My question is for Dr. Roussin. These 2 new cases that were announced today, are they in the Prairie Mountain Health Region? Do you know if they are linked to the cluster there?
They are in the Prairie Mountain Health Region, but there's no link to this to the cluster in that region that we've found.
Has contact tracing identified the transmission chain for those cases yet?
For these new cases, there's been contact investigation that's ongoing, but there's been no link to that cluster.
From Canadian Press, Kelly Malone.
Hi, Kelly Malone from the Canadian Press. Dr. Roussin, you spoke in your comments about how you've heard of people not physically distancing. Do you think that as we talk about lifting restrictions, that we're prepared to lift the next restrictions and move into phase 2?
Yeah, so I think our numbers, we're going to watch our numbers closely, and so we're looking at that right now. Certainly our numbers are all in a good range as we pass this first week of loosening the restrictions. And I think everyone understands it's been challenging times. So a lot of Manitobans have been affected by the slowdowns, by the physical distancing, by the closing of some non-essential businesses. And so I think it's natural as we start to loosen things up that people are happy to get out. The weather's starting to get out, get nice to get out. But I think Manitobans have to realize, and most do, is that we're not done with this virus, and that we could, turn things around and with this virus really quickly if we're not careful. So we still need to be physically distancing, and like I say, it's going to change a lot of what we do. It's not going to be okay to show up to work even if you're mildly ill. It's not going to be okay to show up to school even if you're just mildly ill, and you can't be out shopping when you're mildly ill. And so it's going to be a real change the way we do things. But I think if we do it smartly, if we do it cautiously, follow these numbers, we sure could be looking to move into that next phase near the end of May or early June.
And as we look to the situation developing in the Losh and Saskatchewan, what plans does Manitoba have if a similar situation starts to emerge in our north or far north? And has that situation changed how Manitoba is planning for the possibility of that here?
Did you want to?
I can speak to that, yeah. So we have regular meetings with our partners from the First Nation Inuit Health Branch, as well as some of our clinical leaders who specifically serve the northern population, and our other partners like our emergency response systems. So with this disease, what we have, we believe philosophically that the crux of the effort really needs to happen in the primary care, in the public health part. So we have been working with the First Nations communities, and I have to tell you, they have done a tremendous job working at what plans could be in terms of testing, in terms of isolating, and regular surveillance. If they need to come to move to a site where there is acute care close by, or into an acute care facility, we are preparing to support them in those efforts.
From CTV, Nathan.
Hi there, this one's for Lanette. I received reports that some healthcare facilities aren't ready to start doing elective surgeries again, and it might take until June for them to start doing the surgeries again. Have you heard anything like that?
Well, I have been working with the planning team, and each group of surgeons and surgical teams, including nursing and anesthesia, does have to get themselves organized and prepared. So I imagine there would be different paces that they would start at. We did look at some of the bigger centers, so Brandon, Boundary Trails, Selkirk, starting first. But there may be other ones who are holding off and waiting for, I'm not sure what the reasons are, but I can certainly look into it. But eventually, we never intended to start all elective surgeries instantly on one particular day. It's really about building up capacity and making sure that we can manage, again, longer term. So starting slow and building up.
And I know you sort of touched on this before, but how is the backlog of surgeries being addressed, and do you have a time frame of when it'll be back to normal wait times?
Mm-hmm. So the surgery team is working towards this, and so they are looking at, as they build up week by week, it'll be a gradual making sure that they are managing staffing, beds, equipment, PPE, and I think they're also looking into the summer where there might be opportunities, knowing that staff have already been scheduled to take their vacations, so working kind of around that, but making sure that we get to them as soon as possible. So oftentimes there are some efficiencies, and we've seen that in past crises, like when the St. B flood happened. If we work together and we utilize the time, and there is often opportunities to make up for those cases as soon as possible. So it will be over a period of months for sure, and that's assuming that there are no COVID outbreaks in the meantime where we may need to hold back again. So it's hard to say for sure with 100% certainty, but I know the team is working as hard as they can to develop those plans.
From City TV, Jonas.
Good afternoon, folks. Question for Dr. Roussin regarding some local business fines that were handed out. A couple hefty ones, $2,500. I believe the max fine is that can be handed out in the province. One to a body rub parlor, another to a beauty parlor. Can you elaborate on some of the enforcement measures that are now in place for businesses and what would bring about this max fine scenario?
Right. So, like I mentioned before, is that most of the enforcement is through education, and so the vast majority of Manitobans and Manitoba businesses follow the rules as set out. Some are unable to follow them or were unaware of them, and so just a quick bit of education will get people on board. And so, and then rarely you'll see instances like this where businesses just have not complied. And so certainly the things such as fines, tickets and fines are available. I don't know the specifics behind these particular enforcement procedures here, but if we feel that a business is not following the public health orders and they're putting Manitobans at risk, then we're in a position to enforce that. We have to do what we can to protect Manitobans.
And just a quick follow-up for Dr. Roussin. Why would a massage parlor or a body rub parlor be allowed to open, I guess? Is that part of maybe the issue with the fines? They weren't allowed to open? I mean, they would have been allowed to open, no problem?
That's right. So massage therapists, health professionals have been allowed to open. If this is not the case here, then they would not be a personal service that's been allowed to open.
From the Free Press, Julie.
Hi there, good afternoon. I've got another question about the sort of phased reopening plan. Assuming that things are allowed to go ahead with the second phase starting in June, how long would we have to be successful in that second phase before reopening services listed under future phases, gyms, indoor rec centers, bars, that sort of thing?
Yeah, so typically the period of time to evaluate an initiative like this would be 2 incubation periods. So we would say 28 days. So that should be the minimum time for that. So for these, it's going to be at least 3 weeks, but sometimes up to 4 weeks, depending on how things are going. So that's the guide we're using.
Okay, great. And places like the Iceplex and the rink in Ontario, pro teams were allowed to start using training facilities today with strict protocols. Wondering if anything of that sort is coming from Manitoba as well.
Yeah, we've been looking at it. So this is kind of analogous to businesses that have been able to operate right from the beginning if they only did like online purchases and things, so employees were allowed to enter those facilities. So it would be analogous to that. So we're working on it to see how that would fit here in Manitoba.
From Global, Marnie.
Good afternoon, Marnie Blunt from Global News. Dr. Roussin, when would we expect to see numbers that are potentially reflective of our reopening plan and whether or not people were following it properly, and if that did cause numbers to go up? Would it be around now, which would be about 14 days from when it was announced, or are we not seeing those numbers yet?
Yeah, so to be sure to evaluate, we'll say 2 incubation periods. So that would be near the end of May. But once you start getting within or close to an incubation period, then you might be able to see some of those increased numbers. So we know that the vast majority of people who develop COVID will do so within 10 days of being exposed, but sometimes up to 14. So right around that area is where we could start to expect to see an increase in cases, but we can't be sure until we're looking more at 2 of those incubation periods.
Thank you for that. And my other question is just about the 14-day self-isolation that's required for interprovincial and domestic travelers. With numbers staying relatively low, could we see those travel restrictions eased up before the May long, or if not, when could we expect the mandatory isolation period restrictions to kind of ease up?
Yeah, so those are going to depend on the epidemiology in other regions. And so that's what we're going to be following. So certainly internationally, I don't think we're going to see that change anytime soon. Even interprovincially right now, we're seeing certainly the trend in the right direction throughout Canada. But we're still many provinces that have much higher rates than us. And so unlikely that we're going to see a change of that in this phase.
From the Brandon Sun, Drew.
Thank you. It's Drew Mason, the Brandon Sun. Dr. Roussin, with these two new cases announced today in the primary mental health region, and that they aren't related to the previous cluster, is there concern here that this could be a new cluster that's becoming apparent in the region?
The initial investigation doesn't show us that at this point. So certainly with any case, we do a contact investigation. So I don't have all the details on how many contacts there have been, but it's a little early to consider this a cluster or anything as such. So it's these cases were linked and close contact. So far it's contained.
Okay, thank you. And just as a follow-up, the past couple of days and over the weekend, the new cases have been in the primary mental health region. So is there concern here that this region could be kind of the new second front for the virus in Manitoba?
Well, I think we're going to follow the numbers, right? Of course, those numbers are skewed by that one cluster that's there. So I think there's been 26 cases to date in Prairie Mountain Health, and so there have been cases there before, and we've seen cases in all regions, and so we'll definitely do the typical case and contact management and follow things really closely.
Okay, thank you. We have time for a few more questions. Reporters, we'll go to a round robin. Again, please introduce yourself and ask your questions now.
Diana from 680 CJOB. Question for Dr. Roussin. We're hearing some gyms are holding outdoor classes, kind of with participants spaced out. What are the rules on that? Obviously, gyms not included in the current reopening phase. Is this something that is permissible, and what are the rules around that?
Yeah, right. So we look at a couple factors with that. One is that we're seeing that transmission of this virus is much less likely to occur outdoors. And so as the weather's improving, we want to be on top of Manitobans' other health issues, and physical activity is certainly an important thing. So we allowed gyms to operate outdoor classes only. It's a maximum of 10 students participating with strict physical distancing guidelines, and there's no sharing of equipment. And so the those that are training have to bring their own equipment for that. So pretty strict, but we felt that it allowed a little bit of movement in that industry, and also supporting Manitobans to stay fit.
Aiden from CDC. My question is for Dr. Roussin. I'm wondering about the two new cases that are announced today. Are they currently believed to be community transmission?
Certainly one of them is a close contact to the case, to their close contacts to each other. I don't think we have a known contact, so they are likely going to be, one of them will be considered a community-based transmission.
This is Drew from Brandon Sun. Just to follow up on that question, so if one is community-based transmission, right now, do you know what second case came from?
The second case is a close contact to the initial case. So that's why the way we're looking at community-based transmission, if we can't link an individual to a certain case, then we'll consider that pop-up case, that community-based transmission, and those are the ones we're really following. So these two cases are linked, and so really only one of them we would count as a community-based transmission.
And what about that first one?
The one of the two today that we're announcing?
Yes. So sorry. So just to clarify. So one of these two new cases is community-based transmission.
Yeah.
But do you know at this point where the first case would have come from?
Yeah, that's kind of our definition of when we say community-based transmission is no. If we know if it came from travel or it came from a known case, we wouldn't consider that community-based transmission the way we're looking at it. So that this one case here, we don't know where it was acquired.
Thank you.
Dr. Roussin, Scott Billick here from the Sun again. Reports out of New York showed children developing something called toxic shock-like reactions and symptoms similar to Kawasaki disease they think it's linked to COVID. Have we seen any of that sort of thing here with some of the cases that have come in children?
I haven't received any reports of such. We haven't had a lot of cases in children, but these type of inflammatory conditions often have that viral prodrome to it. So it's going to be interesting to follow the epidemiology on that and to see if that link is tight between those conditions and coronavirus. But it is something that we'll be watching for.
Okay, thank you very much. Is there one more question?
JRB. Just kind of following up on Marnie's question, what would need to happen for interprovincial travel restrictions to kind of drop, whether that be no mandatory 14-day self-isolation? What would have to happen for those restrictions to be loosened, and what could that look like?
So the interprovincial the requirement for 14-day isolation, that's going to be in place as long as we see the rates are higher in other provinces, because we're going to have that. Our risk is high right now for importing this virus to Manitoba, given our numbers. So as we see the rates dropping in other provinces, when we see that there doesn't appear to be increased risk of acquiring the virus in other provinces compared to Manitoba, then we would look to remove that.
All right, thank you. This concludes our briefing.
Thank you.